Hello, it is now 12:30 p.m. Eastern Time. You have joined the 2022 Justice and Mental Health Collaboration Program, commonly referred to as JMHCP Solicitation Webinar. To allow for additional sign-ins past the hour, we will be starting the webinar in a few minutes. Good afternoon. Thank you for joining today's 2022 Justice and Mental Health Collaboration Program Solicitation Webinar. I'm Demetrius Thomas, Deputy Program Director at the Council of State Government's Justice Center. I will be moderating today's webinar, which is funded by the U.S. Department of Justice, Bureau of Justice Assistance, commonly referred to as BJA. Next slide. To give you an overview of today's webinar, first, I will introduce the speakers, then there will be an overview of the Bureau of Justice Assistance, BJA, the Council of State Governments, commonly referred to as CSG Justice Center, and the JMHCP. After that, we will discuss the award information, budget, application criteria, followed by the submission requirements. Finally, toward the end of the webinar, we'll have time for questions and answers. Anytime during the webinar, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to go through as many questions as possible. If you encounter technical or audio problems during this webinar, please click on the links dropped into the chat box. Please understand that there are some technical issues that we may not be able to resolve. We are recording the webinar and will post it on our website by the end of the week. Next slide. We are joined today by Maria Fryer, who is the Justice System and Mental Health Policy Advisor for the Bureau of Justice Assistance with the U.S. Department of Justice. Maria oversees the Justice and Mental Health portfolio and collaborates with the CSG Justice Center to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to help create policy and programming that meets the needs of municipalities and the citizens they serve. Ms. Fryer previously worked at the North Carolina Governor's Crime Commission, where she advised the governor's office on effectively addressing the needs of victims of violent crime. In addition to working with families overcoming violence and instability in Coffee County, Alabama, Ms. Fryer has worked in community corrections in Fayetteville, North Carolina, helping to develop intermediate and community-based sanctions for repeat offenders with drug addictions. She also served in the United States Army as a member of the Military Police Corps. We are also joined by Nikisha Love, who is the State Policy Advisor for the Justice and Mental Health Collaboration Program at Bureau of Justice Assistance in the Office of Justice Programs for the U.S. Department of Justice. Nikisha has been with the Department of Justice Office of Justice Programs since 2008. She is a grants management specialist for the Bureau of Justice Assistance, BJA. In this role, she manages and provides guidance for the administration of the JMHCP grant funding, adult drug court, commonly referred to as ADC grant funding, and justice grant, commonly referred to as JAG grant funding, and COVID grant funding. Ms. Love has a strong financial background and has been managing formula and discretionary grant programs for over 20 years. She first started administrating grants with the Department of Health and Human Services in the Office of Grants Management as a grants management specialist, where she managed over 300 grants for the Office of Community Service and served as a lead specialist for the Assets for Services and served for individual development accounts, grant provided program, and for the Compassion Capital Fund CCF grants. I am Demetrius Thomas, Deputy Program Director in the Behavioral Health Division at the Council of State Governments Justice Center, and I oversee the Justice and Mental Health Collaboration Program, Technical Training and Assistance Grantees. Prior to joining the Justice Center, I worked at the New York City Department of Mental Health and Mental Hygiene, where I led the agency's work at the intersection of criminal justice and mental and behavioral health, including establishing the city's first ever diversion centers, co-response, and mobile crisis teams. Next slide. Next, we'll provide an overview of the mission of BJA, CSU Justice Center, and the JMHCP. Next slide. BJA's mission is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and tribal justice strategies to achieve safer communities. Specifically, BJA provides funding to support law enforcement combat violent and drug-related crime and to combat victimization. Through the development and implementation of policy services and sound grants management, BJA strengthens the nation's criminal justice system and restores security in communities. Next slide. I am now going to give some background on the Council of State Governments Justice Center. The Justice Center is a national, nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government, with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. Next slide. This slide describes a bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing vigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Next slide. Today's webinar is part of the Justice and Mental Health Collaboration Program, again, commonly referred to as JMHCP, Training and Technical Assistance, TTA, which many of you may already be familiar with if you currently have or had a JMHCP TTA grant. The JMHCP TTA promotes innovative cross-system collaboration and provides grants directly to states, local government, and federally recognized indigenous nations to improve responses for people with mental illness and substance use disorders who are involved in the criminal justice system. Next slide. Thanks everyone for joining today's webinar. I'll be back later to moderate the question and answer portion of the webinar. Now I'm going to turn it over to Maria, who will discuss the award information. Maria.
Thank you, Demetrius. Hello, everyone. Thank you for joining today. And we really appreciate everyone's participation in today's webinar, and we hope that you will have a successful application. I'll just go ahead and begin with eligibility. The eligible applicants for the JMHCP grant are city and township governments, county governments, Native American tribal governments, which are federally recognized by the Secretary of the Interior, public and state-controlled institutions of higher learning, special district governments, state governments, and you'll see on the solicitation the word other. Other refers to public and state-controlled institutions of higher education. Agencies with a different legal status, such as nonprofit or for-profit mental health agencies, are eligible to apply only if they have also been designated as a state agency or unit of local government to provide mental health services. Documentation to support this designation must be attached to the application. For the purposes of this solicitation, when you see the word state, this means any state of the United States, the District of Columbia, the Commonwealth of Puerto Rico, the Virgin Islands, Guam, American Samoa, and the Commonwealth of the Northern Mariana Islands. If you would like to know if your entity or organization is designated as a state agency or a unit of local government to provide mental health services, call your local state mental health authority, whose number can be located on the link provided, I believe, right here on the slide, and we also provide it in the chat. If someone could do that, that would be great. All right, next, just to continue with eligibility on the next slide, Eunice, please. Thank you. I want to highlight an important point. JMHCP aims to promote cross-system collaboration. We will only consider applications that are jointly administered by a criminal or a juvenile justice agency and a mental health agency. However, under this solicitation, only one application by any particular applicant will be considered. The other agency or agencies must be proposed as subrecipients or subgrantees. The lead agency must be a city, township, or unit of local government, county government, Native American tribal government, again, which is recognized by the Secretary of the Interior, public and state-controlled institutions of higher education, state governments will need to be the applicant, and other partners would be subrecipients, as I just mentioned. For the next slide, I will move on to the goals. JMHCP offers grants to help entities prepare, create, or expand comprehensive plans to implement collaboration programs that target preliminarily qualified individuals with mental health disorders or co-occurring mental health and substance use disorders. And this preliminarily qualified definition comes from statute that provides the authority for JMHCP. As it relates, the preliminarily qualified offender as it relates to violent offenses, or for those who had oversight over the program that are being implemented in the community or at the state level, those that are implementing the programs do have some authority when determining whether a person who may have a violent offense, if they can participate in a respective program. Specifically, the statute provides that a person is preliminarily qualified if the offender or the person participating has unanimously been approved for participation in the program by a number of stakeholders that are in the community, such as the prosecuting attorney, the defense attorney, probation or corrections official, the judge, or relevant mental health agency. Provided that those who can make approvals such as these entities or these stakeholders, as they determine that the person does not pose a risk of violence to any other person in the program or the public if they're selected to participate. So in making that determination, the statute requires some of these following considerations. And just bear with me, I'm going to go ahead and list them because they're just really important when thinking about the target population. So in determining whether to designate a defendant as a preliminarily qualified offender, The relevant prosecuting attorney, defense attorney, probation, corrections, judge, and mental health or substance use agency representative shall take into account whether the participation of the defendant in the program would pose a substantial risk of violence to the community, whether or not that person has a criminal history or the defendant, and the nature and severity of the offense for which the defendant is charged, the views of any relevant victims to the offense, the extent to which the defendant would benefit from the participation in the program, the extent to which the community would realize cost savings because of the defendant's participation in the program, and whether the defendant satisfies the eligibility criteria program participation unanimously established by relevant prosecuting attorney, defense attorney, probation, corrections, official, judge, and mental health and substance use agency representatives. So you can see there sort of needs to be consensus by all these individuals in the community that the person does not pose a risk of violence to the community or members of the program. So a person who has been charged or convicted of any sex offense or any offense related to the sexual exploitation of children or murder or assault with the intent to commit murder cannot participate in the program. So those are the offenses that there really is no need for consensus because they are absolutely not permitted to participate in the program. So those are things like very serious crimes such as exploitation of children, murder, assault with intent to commit murder. Okay, next slide, slide 13. Thank you, Eunice. This year, JMHCP solicitation is particularly focused on and seeking applications that address one or more of the following objectives. The first objective is to enhance, expand, and operate mental health drop-off crisis stabilization treatment centers that provide 24/7 year-round support for law enforcement, criminal justice agencies, and people who come in contact with the justice system. These centers can provide, but are not limited to, the following services: screening and assessment, crisis care, residential treatment, assisted outpatient mental health treatment, primary care services, telehealth, competency restoration, community transition, and reentry support, such as connections to housing. The next one is increased community workforce and capacity for certified mental health peer support specialists, and increase the availability of wraparound services, evidence to support people with mental health disorders and mental health and substance use disorders. Continue with objectives. Next slide, please. Thank you. Build or expand existing mental health collaboration programs across peoples and places in any part of the criminal justice system, such as jails, courts, and prosecutors, as well as community supervision and or capacity building for criminal justice professionals to target individuals with mental health disorders and mental health and substance use disorders at risk for recidivism. Let's move on to the deliverables. Next slide, please. For applicants who are awarded the JMHCP award, there are a few deliverables that all awardees must complete. First, there is a two-phase process consisting of first planning and second implementation. For phase one, the planning phase, the grant recipients will receive intensive training and technical assistance, or what we refer to as TTA, from BJA's TTA partner. Under this phase, grantees follow a document called the Planning and Implementation Guide, or P&I Guide. This document is refined each year to meet the grantee needs. As outlined in the solicitation, for up to 12 months after receiving final approval on the project's budget from OJP, grantees can spend up to $100,000 during this planning phase to work with the TTA provider on the P&I Guide. So that's up to 12 months. If you do finish prior to that, you can move on to the implementation phase. Past grantees have found that planning phase really helps to prioritize when they get to implementation. The second phase is the implementation phase, which grantees begin after BJA approves the grantee's P&I guide, as well as complete other special conditions under their grant award. The grantees can then spend the remaining grant funds on directly related implementation activities. Next slide. Let's continue with deliverables. In addition, awardees must also develop a coordinated and documented approach to implementing or enhancing services for individuals with mental health disorders or mental health and substance use disorders who come in contact with the justice system corresponding to an activity and the previously mentioned objectives, or planned as a cross-system approach. Initiate the implementation phase once the requirements of the planning phase are complete, and continue to implement for the remaining time of the grant. Next slide. So deliverables continued. The next one is to collect data on program use, efficiencies, and outcomes. Working with a researcher to collect program data, such as demographic data or individuals served, is an allowable expense. Engage in regular training and technical assistance activities with BJA's training and technical assistance partner. Outline plans for obtaining necessary support to sustain and continue the proposed collaboration program following the conclusion of federal support. And certainly collecting data can help sustain a program. Next slide. So program-specific priority areas. The Office of Justice Programs, of which the Bureau of Justice Assistance is a part, weighs many factors when making funding decisions. This includes, but is not limited to, giving priority consideration to applications that meet the following criteria. Supporting Executive Order 13985, advancing racial equity and support for underserved communities through the federal government. To receive this consideration, the applicant must describe how the proposed project will address potential inequities and barriers to equal opportunity or contribute to greater access to services for underserved and historically marginalized populations. Also, to promote effective strategies by law enforcement to identify and reduce the risk of harm to individuals with mental health disorders and improve public safety. We'll continue with priority areas. Next slide, please. So also to promote effective strategies for the identification and treatment of females who have been incarcerated with mental health disorders. To promote effective strategies to expand the use of mental health courts and related services. Also, propose interventions that have been shown by empirical evidence to reduce recidivism. And then, when appropriate, use validated assessment tools to target people incarcerated with a moderate or high risk of recidivism and a need for treatment services. Next slide. And last, to demonstrate and ensure that funds are used for public health and public safety. Demonstrate active participation of co-applicants in administering the project. Document in whole or in part that funds used for treatment of incarcerated populations will provide transition and reentry services for such individuals. To receive priority consideration under any of these areas, applicants must identify in the proposal abstract each area for which priority consideration is being sought and describe in the proposal narrative how the applicant will address each priority. Please note that addressing these priority areas is one of many factors that OJP considers in making funding decisions. Receiving priority consideration for one or more priority areas is not a guarantee of an award. So the next slide is applicant requirements. Again, I just want to reemphasize that applications must include detailed activities for both a planning and an implementation phase, and also include at least one criminal justice agency and one mental health agency that will work on the program together. And that's where the collaboration piece comes in, with roles and responsibilities being described in the submitted and attached Memorandum of Understanding, or known as an MOU. Next slide. Okay, so the award amounts and duration. There is an anticipated total of 27 awards this year in FY22, with each awardee receiving $550,000 for a 36-month, 3-year project, which is expected to begin on the federal fiscal year of October 1, 2022. Thank you for your attention on this piece of the presentation. And next, I will hand it over to Nikisha, my colleague in the programs office, to talk a little bit more about the budget requirements. Nikisha?
Thank you, Maria. Hello, good afternoon. My name is Nikisha Love, and I am a program manager here with BJA. The budget should be complete, cost-effective, and allowable. All costs should be reasonable, applicable, and necessary for project activities. Only $100,000 of funds will be available to complete the planning phase in the first 12 months of the project. The budget should clearly indicate the cost for the planning phase. There are several costs that are not allowable with justice and mental health funding. Justice and mental health does not fund construction. Additionally, prizes, rewards, entertainment, trinkets, or any other monetary incentives, client stipends, gift cards, vehicle purchases, and food and beverages are all unallowable costs. Next slide, please. Justice and mental health authorizes legislation requires a non-federal match of 20% total project costs in project years 1 and 2, and 40% of total project costs in project year 3. Cash and or in-kind third-party match are allowable. Match costs in the budget must meet the same guidelines as federal costs for being allowable, reasonable, applicable, and necessary for the project. It is recommended that you do not include excessive match over the minimum requirements in the application budget. Slide, please. For clarification, the difference between subawards versus procurement contracts. Please carefully review the OJP Grant Application Resource Guide, which is linked in the solicitation subsection titled Information on Proposed Subawards. If any are planned in proposed procurement contracts, again, if any are planned, and the resources linked therein to ensure you properly categorize your costs in these sections. There are different administrative requirements related to each. For example, a procurement contract requires full and open competition, while a subaward does not. Next slide, please. I will now discuss the application criteria. Next slide, please. This information on this slide and the next must be included in all application submissions for an application to meet the basic requirements to advance to peer review and receive consideration for funding. We've also included where each document should be completed and submitted. Slide, please. As well as all the information listed here, please note that applicants are not required to submit performance data with the application. Rather, performance measures information is included as an alert that successful applicants will be required to submit performance data as part of the reporting requirements under the award. Also, an applicant that proposed to use award funds to conduct project evaluations must follow guidance under Note on Project Evaluation under the OJP Grant Application Resource Guide. Next slide, please. Applications that meet the basic minimum requirements will be reviewed by peer reviewers. Applications will be evaluated on how the proposed program address the following criteria, and each criteria is weighed as 15% for the state of the problem description of the issue, 40% for the project design and implementation, 30% for the capabilities and competencies, 5% for the data collection and performance measures plan, and finally, 10% for the budget. Next slide, please. I will now briefly highlight the submission requirements. Next slide, please. Applications must be submitted to DLJ in a two-step process. Step 1, applicants must submit a SF-424 and an SFLLL in grants.gov by 8:59 p.m. Eastern Standard Time on May the 27th, 2022 at the reference link. Please note, to register in Just Grants, applicants will need to obtain a unique entity ID and Systems for Management, which is SAM's registration or renewal. Those of you who may have used to have DUNS number, are now required to now have, as I stated, the unique entity ID. Step 2, applicants must submit the full application, including attachments, including attachments in Just Grants by 8:59 p.m. Eastern Standard Time on June 1st, 2022 at the reference link. All applicants are encouraged to review the How to Apply section in the OJP Grant Application Resource Guide. OJP urges applicants to submit applications at least 72 hours prior to the application due date to allow the application to receive validation messages or rejection notifications from grants.gov and to correct in a timely fashion and problems that may have caused a rejection notification. Next slide, please. Tips to prevent issues. The next 3 slides highlight tips to help prevent issues. 1, remember, there is 2-step submission process. Be clear on the deadline for each process and reference the How to Apply section of the OJP Grant Application Resource Guide. All right. 2, the unique entity identifier used in SAM.gov has changed, as I had stated. On April 4th of 2022, the unique entity identifier used across the federal government changed from the DUNS number to the unique entity ID generated by SAM.gov. The unique entity ID is a 12-character alphanumeric ID assigned to an entity by SAM.gov. As part of this transition, the DUNS number has been removed from SAM.gov. Entity registration, searching, and data entry in SAM.gov now requires use of the new unique entity ID. Existing registered entities can find their unique entity ID by following the steps here. New entities can get their unique entity ID at sam.gov, and if required, complete an entity registration. Step 3. The federal request amount entered in the SF-424 should match the total federal request in your application budget for the entire grant project. Number 4, do not include any of the prohibited costs listed on page 7 and 8 of the solicitation. Next slide, please. Step 5, attach the MOU between the Criminal Justice Agency and the Mental Health Agency partnering on the award. Step 6, all applicants must complete the disclosure of duplication and cost items in Just Grant. Step 7, if funding is being used to pay an outside evaluator or researcher, the applicant must complete the research and evaluation independence and integrity attachment. Again, see the OJP Grant Application Resource Guide for further instructions. At this time, I would like to say thank you and turn it over to Demetrius.
Thank you, Maria. Thank you, Nikisha. Now we will begin the question and answer portion of the webinar. We will respond to as many questions as possible in the time remaining. As a reminder, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. Also, as we are taking questions, we will advance the last slide, which has the contact information of our speakers. Another reminder that I also wanted to provide another reminder that this webinar has been recorded and will be posted along with this slide deck on the CSG Justice Center's website by no later than the end of next week. So we have some questions coming in. The first question that we have, I'm going to kick it to you, Nikisha. It's rather long, so bear with me. The question is, our local mental health authority will be our applicant. After a year of planning, they intend to contract with a nonprofit provider to establish and run a drop-off center. Their drop-off center is going to be crisis receiving and stabilization services. Should the expenses for this CRSS be fully listed on the subaward budget line, as this would be a pass-through contract with a subrecipient?
Yeah.
All right. So they should include the expenses on the subaward budget line.
Yes.
Gotcha. All right. Thank you. Another question just came through. If working with an external evaluator, is there a cap on the evaluation budget? Other funding sources sometimes limit the evaluation budget to some percentage of the total budget. Is this the case with this award? This question is directed to you, Nikisha.
There is not a cap, but we would prefer, that you don't put too much into the evaluator as you are looking to make sure you have enough funds for your program. And if Maria can back me up on that.
Oh, sorry about that, mute. So you're absolutely right, Nikisha. There is not a cap on evaluation. In the solicitation, we don't specify any, cap to that. However, the intent of JMHCP, of course, is to provide services. And I think that's what Nikisha is getting at. If it's just, turns into just a research project, and the majority of the budget is in something other than providing services, then, we might look at that differently. But the intent of JMHCP is to connect people to needed treatment and services. Thank you.
Thanks, Maria. This is the other question, and I'm not sure what the question is getting at, but this is the question: how do we know what the difference is between performance, program measurement, and assessment versus evaluation? I guess this question is for you, Nikisha, just in terms of how they report things. I'm not certain.
Okay. So if I'm understanding, the difference would be between performance and program measurement is your day-to-day activities, if you, whatever has been going on with the program, versus who you have evaluating your program, saying if what you are doing is working. So however you have your scope written out in the project that you will provide, you will report on those services. So that's what the performance and the program measurements are for. Now the assessment and evaluation is, how is it working for your community? And that will be something, of course, down the road that you would probably have to work with CSG to make sure that you are meeting the needs of the project. If I'm understanding, if that's what the
I would agree with that, Nikisha. I think you got it. And, that's about outcomes and how well is the program meeting the goals and objectives, what you intended to do, and how it will inform your practice. And then, performance measures are really the project, what is required for the reporting is really how many of this or how many of that and where and when, and more of the, both quantitative and qualitative, but more reporting out the data of people served. And evaluation would be more about how those people were served and how well were they served and what changes did you make as a result of your evaluation.
Thanks both Maria and Nikisha. Maria, this question is for you. Our county was awarded this grant in 2019. We are still in the period of performance on the current grant. Would we still be eligible to apply for this program to expand this program, or do we have to wait until the current grant program ends and the grant has been closed out?
No, not at all. You don't have to wait. You can absolutely apply, and expanding something that is working really well is a good thing.
Thanks. I'm going to kick this next question over to Nikisha, and it's about budget. Any guidance on how much money we should budget to attend any grantee meetings or the estimated cost of CRT trainings?
Well, I guess it would also depend on what you're asking for as far as in the federal amount and what you're planning to match, and that we don't make this so much of a training award, because again, the purpose is to provide services. So we don't want the bulk of the money going just for training.
Yeah, and I would add to that what Nikisha just stated, that we have a separate, if CRT is crisis response training, and if it's intended for law enforcement, I just want to put a plug in for Connect and Protect Law Enforcement Behavioral Health Responses, which is a separate solicitation intended for training law enforcement. And that is open as well, same time, basically the same time frame as JMHCP. It's actually part of JMHCP, legislated and appropriated through the same channels. However, it does focus on law enforcement on the front end of the system and intercept 0 through 1. So I just want to make sure I added that.
Thanks, Maria. We have two questions. So before I kick these two questions and summarize them to you, Maria, I'm going to read this question. And I can answer the first part, and then I will leave it up to you, Nikisha or Maria, to answer the second part. Will slides and webinar be on the website by this week, since the initial submission dates is 5/27 next Friday, and we have a holiday weekend after that. Also submitting 72 hours prior recommendation to June 1 would be a Sunday, May 29th. Will there be responses or denials by Monday, Memorial Day, for applications deemed incomplete. I can answer that first part. It's unlikely that we will have this slides up on our website by the end of this week, but like I said, we will definitely try to have it up by the beginning of next week, so that you can use this as a continued resource guide. In terms of the denial responses by Monday, Memorial Day, for applications deemed incomplete, I'm going to kick that question to either Nikisha or Maria. Will you all by any chance have the answer to that?
I'll let Maria answer that one.
Okay, well, all the holidays in between, if I kind of remove that, I'm trying to get my time frame straight here. So there's two deadlines. Let me just start there. I think it's important to realize is that grants.gov is May 27th, 8:59 p.m. You've got to get your request for federal assistance in at that time first in order to move forward to submitting the rest of the application, the step 2 in grants.gov. So the first deadline is May 27th, 8:59 p.m. We recommend that you start submitting 72 hours in advance because things just technical problems, or for whatever reason, you've got to reach out and get a question answered from grants.gov. You have time to react when there's a problem. If you start 72 hours out, we're not saying you have to do that. I mean, if you want to get it in at 8 o'clock on May 27th and everything goes smooth, you're one of the lucky ones. But we know that there's always hiccups, there's always thunderstorms, there's always all kinds of things that happen. So we recommend that you start 72 hours ahead of time so that you can resolve any issues that come up. That's what that is there for. So I hope that answers the question. If not, Demetrius, you might have to read again.
Okay, sounds good. No worries. If there's any follow-up again to that question, feel free to drop it in the Slack and we can answer. But here is the slide that has that information on it. Also, if you have any questions about that, definitely refer to the application resource guide that we previously dropped in the link. Another question, Maria, this question is for you. It's two questions, but I'm going to combine them. Can you please clarify the applicant eligibility requirement? It was mentioned in one of the earlier slides that the lead applicant must sub-grant to the partner agency. So I'm going to actually stop there because they're slightly different. So I'm going to read that again. Please clarify that, and this is still to you, Maria. Please clarify the applicant eligibility requirement. It was mentioned in one of the earlier slides that the lead applicant must sub-grant to the partner agency.
Okay, so eligibility is really, it's a state, tribal, or local government entity. And that is separate and apart from the partnership requirement. So I want to make sure that's clear first. The partnership requirement is that it's a collaborative program, and we require a partnership between a criminal justice entity, which I see the question there, and that's going to be an agency. There's an actual definition for it, for what a criminal justice agency is, or a juvenile justice agency, and it's like the ability to charge a person or detain a person or something like that. But you and I, as professionals, we know that that's like law enforcement, jails, courts, any part of the criminal justice continuum, probation, parole. And if you need that technical definition, I can certainly follow up and get that to you. But so the partnership requirement is between the criminal justice entity and the mental health provider, the clinician, the clinical side of it. And that if that's a nonprofit and they do a great job and that's your partner, that's fine. You know, that is okay. But if, say, we provided this example yesterday, say you're a law enforcement agency, maybe you're a very small rural sheriff's office, maybe, you know, Utah, New Mexico, or something like that. You're in a really rural area and you are very small and you're concerned about the capacity to manage a federal award. But your mental health partner, your behavioral health partner, maybe comes from a larger organization that can manage a federal award. And the only thing is they're a nonprofit and you're concerned that they might not be eligible to apply. Well, if they are designated as a state agency, so the state mental health authority, when we provided that sample link, that lists all the state mental health authorities. So if that nonprofit is listed as a designated agency for the state to provide mental health services, that they're listed somewhere, not just that they're credentialed, you know, they're credentialed by the state or they're certified by the state, or, you know, that they have a contract. It has to be that they are a designated to provide services as the state agency. So in effect, we satisfy the legislative requirement that they are, like, in fact, a state agency. So if that agency has the capacity to apply and then partner with the sheriff's office, that will work if they're a designated state agency and a mental health agency. So it is very complex. The legislation is complex. So there's two things to consider. One is the collaborative partnership has to be between a criminal justice agency and a mental health agency or a behavioral health partner to provide services, obviously. And then the second piece is who is applying. It has to come from a state, tribal, or local government entity. And if that mental health agency is a designated state agency, as designated as a state agency, or is the state mental health authority, then they are eligible to apply and then partner with the criminal justice entity. So you have to think about two things, the partnership, and then you have to think about who should apply. And you have to think about that really carefully, because that who should apply has to be eligible.
Thanks, Maria. That was a great way to summarize it, and I think that answered the question. Thanks so much. Do we have any other questions coming through?